Hi everybody and welcome to my channel Hobit BB. Earlier I posted a short introductory video about ectopic pregnancy. I hope you have already seen that video. And today in this video I am going to discuss this dangerous condition in detail. So please watch and listen to this video very carefully. Pregnancy begins with a fertilized egg. Normally the fertilized egg attaches to the lining of the uterus. An ectopic pregnancy occurs when a fertilized egg implants and grows outside the main cavity of the uterus. An ectopic pregnancy most often occurs in a fallopian tube which carries eggs from the ovaries to the uterus. This type of ectopic pregnancy is called a tubal pregnancy. Sometimes an ectopic pregnancy occurs in other areas of the body such as the ovary, abdominal cavity or the lower part of the uterus which is known as cervix. And you know very well that cervix connects to the vagina. An ectopic pregnancy can't proceed normally. The fertilized egg cannot survive and the growing tissue may cause life-threatening bleeding if left untreated. Now I'll tell you the symptoms of ectopic pregnancy. You may not notice any symptoms at first. However, some women who have an ectopic pregnancy have the usual early signs or symptoms of pregnancy, which is a missed period, breast tenderness and nausea. If you take a pregnancy test, the result will be positive. Still, an ectopic pregnancy cannot continue as normal. As the fertilized egg grows in the improper place, signs and symptoms become more noticeable. And there are early warnings of ectopic pregnancy. Often the first warning sign of an ectopic pregnancy are light vaginal bleeding and pelvic pain. If blood leaks from the fallopian tube, you may feel shoulder pain or an urge to have a bowel movement. Your specific symptoms depend on where the blood collects and which nerves are irritated. There are emergency symptoms which you should know. If the fertilized egg continues to grow in the fallopian tube, it can cause the tube to rupture. Heavy bleeding inside the abdomen is likely. Symptoms of this life-threatening event include extreme lightheadedness, fainting and shock. You should seek emergency medical help if you have any signs or symptoms of an ectopic pregnancy, including severe abdominal or pelvic pain accompanied by vaginal bleeding, extreme lightheadedness or fainting, or if you suffer from shoulder pain. Now let me tell you the causes. A tubal pregnancy, the most common type of ectopic pregnancy, happens when a fertilized egg gets stuck on its way to the uterus, often because the fallopian tube is damaged by inflammation or is mishappen. Hormonal imbalances or abnormal development of the fertilized egg also might play a role. Now let me tell you the risk factors. Some things that make you more likely to have an ectopic pregnancy are previous ectopic pregnancy. If you have had this type of pregnancy before, you are more likely to have another. Another risk factor is inflammation or infection. Sexually transmitted infections such as gonorrhea or chlamydia can cause inflammation in the tubes and other nearby organs and increases your risk of an ectopic pregnancy. Fertility treatment. Some research suggests that women who have in vitro fertilization, that is IVF, or similar treatments are more likely to have an ectopic pregnancy. Infertility itself may also raise your risk. Tubal surgery. Surgery to correct a closed or damaged fallopian tube can increase the risk of an ectopic pregnancy. Choice of birth control. The chance of getting pregnant while using an intrauterine device is rare. However, if you do get pregnant with an IUD in place, it's more likely to be ectopic. Tubal ligation, a permanent method of birth control commonly known as having your tubes tied, also raises your risk if you become pregnant after this procedure. Smoking. Cigarette smoking just before you get pregnant can increase the risk of an ectopic pregnancy. The more you smoke, the greater the risk. Now I should tell you the complications. An ectopic pregnancy can cause your fallopian tube to burst open. Without treatment, the ruptured tube can lead to life-threatening bleeding. And now I should tell you the prevention. There is no way to prevent an ectopic pregnancy, but there are some ways to decrease your risk. These are limiting the number of sexual partners and using a condom during sex helps to prevent sexually transmitted infection and reduces the risk of pelvic inflammatory disease. Well, on my channel Hobet BP, I have already posted a video about pelvic inflammatory disease in which I have discussed the sexually transmitted infections which can lead to pelvic inflammatory disease. So that video is very important. Please see that video. Okay. Another way of prevention is that you should not smoke. If you do, quit before you try to get pregnant. Now I should tell you the diagnosis. Well, coming to the diagnosis, a pelvic exam can help your doctor identify areas of pain, tenderness, or a mass in the fallopian tube or ovary. However, your doctor cannot diagnose an ectopic pregnancy just by examining you. You will need blood test and an ultrasound. Pregnancy test. Your doctor will order the human chorionic gonadotropin, that is HCG, blood test to confirm that you are pregnant. Levels of this hormone increase during pregnancy. This blood test may be repeated every few days until ultrasound testing can confirm or rule out an ectopic pregnancy, usually about 5 to 6 weeks after conception. Ultrasound. A transvaginal ultrasound allows your doctor to see the exact location of your pregnancy. For this test, a wand-like device is placed into your vagina. It uses sound waves to create images of your uterus, ovaries, and fallopian tubes and sends the picture to a nearby monitor. Abdominal ultrasound, in which an ultrasound band is moved over your belly, may be used to confirm your pregnancy or evaluate for internal bleeding. Other blood tests. A complete blood count will be done to check for anemia or other signs of blood loss. If you are diagnosed with an ectopic pregnancy, your doctor may also order tests to check your blood type in case you need a transfusion. Now let me tell you the treatment. A fertilized egg cannot develop normally outside the uterus. To prevent life-threatening complications, the ectopic tissue needs to be removed. Depending on your symptoms and when the ectopic pregnancy is discovered, this may be done using medication, laparoscopic surgery, or abdominal surgery. Now first I should tell you the medication. An early ectopic pregnancy without unstable bleeding is most often treated with a medication called methotrexate, which stops cell growth and dissolves existing cells. The medication is given by injection. It is very important that the diagnosis of ectopic pregnancy is certain before receiving this treatment. After the injection, your doctor will order another HCG test to determine how well treatment is working and if you need more medication. Laparoscopic procedures. Salpingostomy and salpingectomy are two laparoscopic surgeries used to treat some ectopic pregnancies. In these procedures, a small incision is made in the abdomen, near or in the navel. Next, your doctor uses a thin tube equipped with a camera lens and light, which is known as laparoscope, to view the tubal area. In salpingostomy, the ectopic pregnancy is removed and the tube left to heal on its own. In salpingectomy, the ectopic pregnancy and the tube are both removed. Which procedure you have depends on the amount of bleeding and damage and whether the tube has ruptured. Also, a factor is whether your other fallopian tube is normal or shows signs of prior damage. Emergency surgery. If the ectopic pregnancy is causing heavy bleeding, you might need emergency surgery. This can be done laparoscopically or through an abdominal incision, which is known as laparotomy. In some cases, the fallopian tube can be saved. Typically, however, a ruptured tube must be removed. Since this ectopic pregnancy is a dangerous and life-threatening condition, so coping and support is very necessary. Losing a pregnancy is devastating even if you have only known about it for a short time. Recognize the loss and give yourself time to grieve. Talk about your feelings and allow yourself to experience them fully. Rely on your partner, loved ones, and friends for support. You might also seek the help of a support group, grief counselor, or other mental health provider. Many women who have an ectopic pregnancy go on to have a future healthy pregnancy. The female body normally has two fallopian tubes. If one is damaged or removed, an egg may join with the sperm in the other tube and then travel to the uterus. If both fallopian tubes have been injured or removed, in vitro fertilization, that is IVF, might still be an option. With this procedure, mature eggs are fertilized in a lab and then implanted into the uterus. If you have had an ectopic pregnancy, your risk of having another one is increased. If you wish to try to get pregnant again, it is very important to see your doctor regularly. Early blood tests are recommended for all women who have had an ectopic pregnancy. Blood test and ultrasound testing can alert your doctor if another ectopic pregnancy is developing. Well, this was my detailed video about ectopic pregnancy. I hope you have listened to this and watched this video very carefully. And till now, if you haven't subscribed my channel, please subscribe it now and click the bell icon so that all upcoming videos are delivered to your inbox straight away. And do not forget to comment about this video if you like it or not. And then if you suffer from this condition or any other illness, please post comment about your illness and I'll try to make a video about your illness. And if I don't find a time, then I'll try to reply to your comment as soon as possible, because I reply to your comments almost every comment. Okay. And please do not forget to give a thumbs up to this video, and also share this video with others through social media such as Facebook and Twitter, because this channel of mine, Hobet Bibi, is basically created to help humanity across the world. So by sharing my videos to others, you will be part of this great initiative. Thank you very much for watching this video. See you in next video. Bye for now.